Hello and welcome to the program. My name is Marie Yambo and we're coming to you from Ngerenya location in Kilifi North Sub-County, Kilifi County. And today we will be talking to scientists from the Kenya Medical Research Institute on the issue of community engagement in as far as research is concerned. Ngerenya village, Kilifi North Sub-County, Kilifi County, is home to 24-year-old Raymond Shume. Shume has been battling sickle cell anemia since birth. His story is one of courage, resilience, and hope despite facing a chronic and often debilitating illness.
Nilikuwa nimezaliwa tu sawa hivyo. Mkono tu ulikuwa ndo so nilipofika class 4 ndo nikawa nacheza mpira na wenzangu shuleni. So someone akanipush mara ya kwanza, then nikacheza, nikaendelea kucheza, then akanipush tena mara ya pili. So after hapo ndo nikaanza hiyo joint kudislocate. So nilipoenda usi kapimwa zaidi, nikajulikana kwa hiyo chanzo ya hiyo kuanguka is about the sickle cell, ambayo ndo ilichangia ndo maana ikawa hivyo.
Sickle cell anemia is an inherited blood disorder that affects the red blood cells, causing them to become distorted and break down. This can result in a range of symptoms, including chronic pain, fatigue, infections, and organ damage. Despite the challenges, Raymond has remained determined to live his life to the fullest and not let his illness define him. He is a graphic designer and runs a cyber cafe to earn a living.
Katika familia yetu tulizaliwa 6, and then after hapo mamangu alipasi, then akaolewa bibi mwingine ambaye alizaa watoto wawili. So sisi kwa mama yetu ilikuwa ni 6, so mimi nilikuwa the 4th of the child. So kuna si mimi peke yangu, ilikuwa kuna sickle cell, kuna my elder sister alikuwa na sickle cell. Nilipomaliza tu college ya graphic design nikakaa tu nyumbani, but after all wazazi wakaniambia tu wacha tufungulie mahali ujiendeleze na wewe, kuliko kukaa nyumbani utapata hata shilingi, utateseka bure. So wakaamua tu wanianzishie kazi ambayo ilikuwa last year. Yeah. So mimi sikufa moyo, kaendelea hivi. Mara ya kwanza ilikuwa nang'ang'ana, yani naweza keti hapa hivi, hakuna wateja, washinda hivi. Sasa moyo wafa moyo, lakini sasa marafiki wasema usife moyo, wewe nenda kazi ufungue. Ufungue, baada ya hapo wiki na kisonga uta catch up. So mpaka sasa hii watu wame catch up, wamezoea, wanakuja, wacha twende kupige photocopy kwa Baraka, kaingize movie kwa Baraka.
He has learned to manage his symptoms through a combination of regular checkups, lifestyle changes, and medication, which he says is often too expensive.
Kwa wiki naweza tumia dawa mara 3. Hiyo bei ya dawa isiku ghali, but huwa nachukua Kilifi County, Kembre. Lakini sasa hiyo dawa ukienda mpoa kule dawa ni mpaka ununue. Na sasa kununua kwa afford ile dawa, maybe someone hana uwezo wa kununua hizo dawa, so anateseka. Lakini sasa kwa vile mimi niko na kazi yangu, naweza kujimudu na kupata pesa kwenda kununua hizo dawa. Lakini kuna wengine hawana kazi, wako hivyo, lakini sasa wako na challenge ya kupata ile dawa.
Raymond is also a strong advocate for sickle cell awareness. In this book titled Heroes of Sickle Cell, Baraka the Dreamer talks about Raymond's aspirations to become a footballer, but his condition could not allow. He, however, devises another way. As an artist, he draws pictures of his friends playing the game. The book, he says, is to raise awareness about the condition and its impact on individuals and families.
Maoni yangu kwa watu wakisoma hichi kitabu, nataka uelewe zaidi kuhusu ugonjwa. Si wote ambao wanaelewa ugonjwa unakaa hivi na hivi. Ni wachache sana, hata kuna wengi huku sana huku hivi. Ukienda kuuliza hicho kitabu, ukimpatia kitabu akiangalia, atakuuliza, "Huu ni ugonjwa gani?" So nataka wakipata hicho kitabu waelewe kuhusu ugonjwa unakaa vipi, yani kuna ugonjwa pia unakaa kama hivi. Yeah.
Despite the ongoing challenges of managing his condition, Raymond remains optimistic about his future and is committed to pursuing his dreams and making a positive impact in the world.
Mwisho wangu ulikuwa ni kuachieve the dream, nipate kazi, nijiendeleze kimaisha. If you are sure that is what you want, we will support you. Which college do you want to go to? I want to continue with art and design. It's my dream for the future.
Scientists from the Kenya Medical Research Institute, KEMRI, have been conducting community-based research on sickle cell anemia in Ngerenya village, Kilifi County, with the aim of sensitizing residents about the condition, how one gets it, and its management. Why is it important to engage the community when it comes to issues of research? Specifically, we will be dealing with sickle cell anemia research here in Kilifi County and in Ngerenya location. Now, to talk to us is Noni Mumba, who is the head of community engagement here at KEMRI in Kilifi County. Thank you so much for being with us. My first question to you, though, is why is it important to engage the community when it comes to research?
Engaging the population is very important. Research is conducted mainly with community members. So a scientist who wants to check whether a particular drug is working or wants to ask certain questions about an illness in a locality, maybe wants to find out whether there are certain environmental things, behaviors that are contributing towards an illness, has to conduct either interviews with community members or has to collect samples from community members. So it's very important as a good thing to do, to talk to community members, engage them, get to listen to their lived experiences on health issues before one gets into that community to conduct a research. We are in Ngerenya location today. Ngerenya location is in Kilifi County. It is one of the 16 locations in an area where we call it Kilifi Health and Demographic Surveillance System area. In this area, we conduct most of our research as KEMRI Kilifi, or as KEMRI Center for Geographic Medicine Research Coast. There are other areas such as Malindi, Mtwapa, Mombasa County, but in Kilifi here, we have 16 locations, and Ngerenya location is one of them. In these 16 locations, as a research institute, we are required to have community advisory boards. And so from these 16 locations, we have about 225 community members that serve as community advisory board members, and they are called KEMRI community representatives. So in Ngerenya location, we have a group of 9. In these 16 locations, some have about 9 members, others have 10 members, others have even up to 25 members. The roles of KEMRI community representatives is to be a link between the research institute and the community. So when researchers want to have a discussion with community members, this community advisory board is the group that they will go to have conversations about the research work that they are doing.
What has been the impact and success of engaging the community in research in this area?
Involving the community in our work has been really helpful. For one, it has enabled us to carry out research activities, because without community consent and without communities even understanding what it is that we are doing, the type of research work that we do, then it's even difficult or challenging to do ethical research, because ethical guidelines require that community members are engaged and they have a voice in research that is happening. So one of the successes that we have had with the community advisory board and us engaging with even just the broader population is that it has enabled our research work to continue. For now over 3 decades. We've been conducting research for over 3 decades in Kilifi County, and that we can just credit that to the good relationship that we have deliberately made with the community members. Again, the community members have given us insights into how better we can make our engagement activities. For example, science is complex, scientific terms are technical, and we have worked with these community members to be able to translate, for example, scientific terms to Kiswahili or to the local vernacular. And what that means then is that when we are giving research information using an information and consent form that outlines all the technical information, or rather all the research information that a research participant needs to know before they can consent to join a study, then they have basically helped us in that we are able now to translate that information to Swahili and to local vernacular, for example in Ngerenya, because we've worked with them to look at those scientific terms, what would they be called in the local language, and then translate that. So our communication is better because we are learning even from them in terms of culture, how do you communicate, at what point, and those kinds of things.
That was Sophie Mumba, who is the head of Community Engagement, Kenya Medical Research Institute, KEMRI, in Kilifi County. We now want to talk to one of the scientists, actually the lead scientist, who is conducting research, or at least a trial of a drug on sickle cell anemia, and that is Dr. Sophie Uyoga. Thank you so much, Dr. Sophie, for being with us. And my first question to you is, could you paint for us a picture of how the condition is in the country and which parts of the country are most affected by sickle cell anemia?
We are between 0.8 and 1% generally, because it depends on the hotspots where you'd find a lot more cases. So it would range from 0.8% to 1%. Both Western Kenya, at the coast we know for sure it's 0.8% of the population is affected by the disease. In Kilifi it's 0.8%, that's what I'm saying. So in Western Kenya, I think the studies that were done there, it was about 1% or 0.8% thereabout. It hasn't gone beyond 1% in Kenya. Yeah, that's what we know, based on the little data that is available, because there isn't much. We'll get a lot more information with the newborn screening program that I've started. I know Kisumu County has started newborn screening, so we'll start seeing the real data from some of these areas now that newborn screening is being enrolled and being rolled out by the Ministry of Health. That will give us better data. The research has grown from trying to describe what the problem is to we are now currently looking at management and treatment interventions for this particular problem in terms of medication. So we have a drug trial for hydroxyurea, which is the key management therapy in use in Kenya, and is actually now on the guidelines developed by the Ministry of Health. We're also looking at how the clinical presentation of these patients to try and understand the causes of disease and why they get severe attacks, and how to manage the severe attacks through managements like blood transfusion, which is part of the research that we are doing, to try and make sure that their blood is well matched so that it helps them and they don't end up coming back with recurrent anemia, because the more admissions they have requiring transfusions, we are depleting an already limited resource.
Other than the use of the hydroxyurea medicine to manage sickle cell anemia, there's also the use of bone marrow transplants that can actually, be used to manage sickle cell anemia. So, are we at the point in Kenya where bone marrow transplant can be accessible to the community who need it?
It's expensive, and also you have to invest in the professionals to do the service. So it's an investment in the infrastructure and in the personnel. And I think we are way far behind. The private hospitals definitely are way ahead. But also it comes to a matter of cost. So who's going to cover the cost of that intervention? Most of the affected families are literally poor. They're struggling to even buy the drugs that their children are using. So they can't afford to pay for treatment that's in the millions. So if that is to be made available in public hospitals, you need to invest in the infrastructure, you need to invest in the personnel, and you need to invest in the healthcare insurance. So if it's NHIF, then they need to have a package for these particular patients who are affected. Would NHIF be able to cover at least a fraction of the cost of that? Then that makes it more reachable for these parents. But as at right now, it's really, like it's a pipeline dream. It's there, but it's not reachable. I think that is the challenge.
With all the advancement in technology and the research that has been done in the use of medicine and all that, do you think there's ever going to be a time that sickle cell anemia can be eradicated? And also, what is the importance of sensitizing the community in terms of, in as far as sickle cell anemia is concerned?
Eradication is a process, and that's why educating the community is important, because they need to understand that it's a genetic condition. You inherit it from the parents. So the affected families now know that they need to go for genetic counseling and testing before marriage. So that already reduces the chances of the affected families having another generation of children who are affected. So it will improve, but over a long period of time. It's not something that can happen immediately, but what we're appreciating is the fact that now that the community has understood what the disease is about, there's less stigmatization about the disease. So those who are affected can, have that discussion, open discussion with their partners before they get married. And even as these children come to the clinic, those are some of the things we educate them about, that when you get to that stage where you want to have a family, you need to, one, get tested, and get your partner tested, so that you're making an informed decision, because you've grown with the disease, you know the burden of the disease, you don't want to pass that on to your children. So we are glad that we are seeing, because we have patients who are now getting to that category of now becoming mothers and becoming fathers, and they are looking out for people who have not carried these genes, to at least make sure that their children are born with as normal.
There are myths and misconceptions in as far as sickle cell anemia is concerned. There are people who think like it's contagious. Maybe you could talk to us about that.
So it's a chance event that happens at conception. So you inherit it from both parents. Depending on the easiest explanation is you have a trait and a trait getting married. So that means they have 25% chance of their child having that particular pregnancy, having sickle cell disease. They have 50% chance of that pregnancy having sickle cell trait, and 25% chance of that pregnancy coming out as sickle cell trait. So it is within a pregnancy. So with every pregnancy, you carry the same risk over and over and over. So it's essentially a gamble. The first pregnancy, you might pick the 25% with sickle cell. Second pregnancy, another 25% comes out. Third pregnancy, you get the 25 with normal, or the 50 with sickle cell trait. So it is, the risk is per pregnancy, not per child that you give birth to, no. So the understanding is that at conception, so with every pregnancy, the risks are the same, or the chances of handing that down to your to your baby are the same.
So we've just heard how it is important for the community to be engaged in research, and this is where the provincial administration plays a very big role. Now, to speak to us about community engagement and how the community has benefited here in Ngerenya, our location in Kilifi North, is none other than the Ngerenya Senior Chief, that is Tekla Chai. Thank you so much for being in the program. Kwanza tuanze na umuhimu wa utafiti. Kuna umuhimu gani wa kuhusisha jamii katika utafiti?
Wamama wengi katika community sahii wamebadilika. Wamebadilika kwa sababu ya ile elimu wanapata kupitia mashirika kama vile KEMRI. Unajua kitambo, labda ungeenda tu hospitali na unapewa dawa, hakuna ile support kutoka mahali popote, ni wewe tu na dawa yako. Lakini sasa hii unapata hata unapoenda ukipewa ile dawa ya sickle cell, kwa mfano sasa kama hapa, nikisimama kwenye baraza nitaongea the same thing ya sickle cell. So yule mwananchi anaona, kumbe ile dawa kweli ni dawa, kwa sababu sasa nimesikia hata chifu anaongea. Juzi nilienda mahali pengine nikasikia dispensary pia wanaongea, kwa sababu ya ile elimu, sensitizations zimesaidia. So wazazi wengi wamekuwa wanafuatilia vile inavyostahili.
Unaweza kusema ni vipi jamii hii ya Ngerenya imeweza kunufaika na utafiti huu ambao umekuwa ukiendelea hapa kuhusiana na selimundu ama sickle cell?
So sisi kama community tumefurahikia sana hiyo maongezi na mazungumzo, na kwa hakika itasaidia sana community, kwa sababu tunapotoka hapa, mimi kama chief kwenye baraza zangu nitahamasisha community kuhusu ugonjwa, na hata kama kuna mzazi ambaye labda ameficha mtoto wake nyumbani kwa sababu anafikiria labda ni unyanyapaa, nimwambie aweze kutoa mtoto wake ampeleke hospitali kuu ya Kilifi akaguliwe, na kama yuko na hiyo ugonjwa aanze tiba ili aishi maisha kama ya watu wengine.
Wewe pia ni mwathiriwa wa ugonjwa huu wa selimundu ama sickle cell. Unaweza tu kutuelezea?
Mimi ni mzazi wa watoto wawili. Mtoto wangu wa kwanza ni msichana na alikuwa hana shida yoyote. Lakini mtoto wa pili alivyokuwa yuko na kama miezi 6, akaanza complications za malaria. Leo unasema ni homa. Ukienda hospitali, unaporudi nyumbani, ukifika pale nyumbani, homa imezidi, hata unageuka unarudi kule hospitali. Ndiposa nikaamua kutafuta mtaalamu wa watoto kule Mombasa, na hiyo ni miaka ya nyuma sana. That is 1998, 99 hapo. So nikatafuta mtaalamu wa watoto, na nilipofika kule kwa mtaalamu wa watoto, nikaona anatutizama mimi na mume wangu. Akatuangalia kwa macho, nikaona akaangalia vichwa vyetu, akatuambia, mimi kabla sijapima huu mtoto lakini nashuku ugonjwa fulani, lakini waacha tuende kwa mahabara ili tupate udhibitisho. Alivoregesha majibu akatuambia huu mtoto ana sickle cell. So tukajiuliza mimi na mume wangu, sickle cell imetoka wapi? Mimi kwetu sijasikia, yeye naye akasema kwetu sijasikia. So tukabaki pale kujishangaa. So na sasa kwa sababu nafikiri ilikuwa haijafanyiwa utaalamu wa utafiti, akatuambia kwamba huyu alikuwa ni my second born. Nikizaa third born atakuwa yuko na nini? Sickle cell. Sasa niko na hiyo tabu nilikuwa napitia na yule mtoto, nikasema hapana, hata sitaki kuzaa tena. So nikapika break na watoto wawili. Maana niliambiwa the third born atakuwa na sickle cell. So nikaamua kupiga break. So akapewa matibabu, na sasa hii nashukuru anaendelea vizuri. Ni kijana mkubwa, yuko na 25 years. Na ninashukuru pia sasa hii amenipa mtoto na yeye, a baby girl.
Kuna watu ambao wanaamini kwamba watoto ambao wanapatikana na selimundu ama sickle cell hawawezi kuishi wakapitisha umri miaka 5. Lakini kijana wako kwa sasa unasema ni mtu mzima ambaye sasa ameoa na wewe mwenyewe kuna mjukuu. Unaweza kuwapatia ushauri gani kina mama ambao wako na watoto ambao wako na ugonjwa huu wa selimundu?
Tafadhali tutiini maagizo ya madaktari. Hiyo tu ndio ilinisaidia kwa mtoto wangu, kwa sababu kama ni dawa iko na mezwa na masaa yake, kwa hivyo fuatilia ile kitu inatusumbua sisi kama wanajamii. Unapotoka kule hospitali unakuja unapata walimu wako huku nyanjani. Daktari amekwambia umeze dawa mara 3, achana na hiyo, twende ukaombewe. Unaona mtoto unaacha kumeza dawa kwa sababu umeambiwa na rafiki kwamba twende ukaombewe. Maombini twende, lakini dawa ya daktari tafadhali tutilie maanani vile ambavyo tumeelezewa tutumie. Hiyo tu ndio itatusaidia. Lakini kama utaenda kule na uje usifuatilie maagizo ya daktari, utaona hiyo dawa haitafanya kazi. Haitafanya kazi kabisa.
Thank you so much for taking the time to be with us in the program. We have been talking about sickle cell anemia and the research that the Kenya Medical Research Institute has been conducting here in Kilifi North Sub-County. Thank you so much. We hope to see you again next time. My name is Marie Yambo.